everybody, welcome to Pick Dr. Osborne's Brain. Got a great Q&A for you today. If you've got questions you'd like me to answer about nutrition, diet, and lifestyle, type away. We're here to get them answered. I'll do as many as I can in the allotted time. If you missed the show on how to find a great functional doctor and the problems that we face in our medical community today, make sure you go but check that out. I did a pretty in-depth analysis and assessment on the status of healthcare and what you should look for in a good doctor in order to find the best possible care for yourself if you should need a functional care practitioner. Okay, let's dive into your questions. TC says, how long can you take Pal de Arco in a stretch before taking a break? It's working for me with Candida overgrowth, but I don't know how long is it okay. How long it is okay for about 1,000 to 1,200 milligrams. I assume you mean per day, TC. It depends on the person. You know, if you're on it for a long period of time, you should definitely make sure to monitor your blood, especially your liver enzymes. But I would say 10 weeks, I wouldn't do it any longer than 10 weeks, especially not without guidance, as just a general rule of safety, to be as safe as possible. And some doctors would say even less than that. Some would say no longer than 2 to 4 weeks. But I have found with numerous people with Candida overgrowth and other problems that it 10 weeks is generally really safe. But you do want to monitor them, or you do want to be monitored. Let's see, Dr. Osborne, what test procedure chelation would you use for gadolinium toxicity? Gadolinium responds, in my experience, really well to a mixture of things: EDTA, alpha-lipoic acid, N-acetylcysteine, all good things to use as chelating agents for that. We see it pull really well clinically. As far as what test to identify gadolinium, pre and post urinary provocation is one of the best ways to go about doing that. And so those are urine tests. Let's see here. LP test says I'm deficient in deficient in asparagine, borderline in glutamine, glycine. How to increase? Well, those are all amino acids. So you could start by assessing how much protein you're getting in on a daily basis and make sure it's enough. If you're not getting, at least, depending on your age and weight and everything, but at least 1.5 grams of protein per kilogram of body weight is a good place to start to try to boost those up. But glutamine, as far as how much can you take, athletes will use anywhere from 5 to 10 grams a day for training. It's very safe if you're just trying to supplement with, generally in that way, about 1,500 milligrams a day. Same thing with glycine. Same thing with asparagine. You won't find much information on asparagine. There's not a lot of research studies focusing in on asparagine. We've got a lot of internal research on it, where what we find with asparagine, well, one, it's super important for replication of new DNA and RNA, so very important for the healing. But where I see asparagine deficiency probably most frequently is in people with rheumatological arthritides, so rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis, etc. So the question about Epstein-Barr, you're talking about viral antibodies. Everyone has Epstein-Barr antibody titers. I don't generally, I disagree. There's a lot of people out there that talk about you need to treat Epstein-Barr virus, and I don't believe that at all. I haven't seen that clinically to ever pan out to be helpful for people. I find that Epstein-Barr titers generally are high if a person's immune system is either weakened or in a disrupted state. And so viruses generally are stored in human neurological tissue, and when the immune system's dysfunctional, those viruses can replicate and come out, and we'll see higher titers. And if you control the immune system responses and you get the immune system healthy, then viral titers go away. But treating them with things like antivirals per se, never have I seen that really be all that influential or helpful. As a vegetarian, brain health and healthy fats are not easily available, or are they? Please give direction in this area. Well, one, I would ask you why you're a vegetarian. And if you're a vegetarian, do you eat eggs? Do you eat dairy? Do you eat any other animal products at all? What kind of vegetarian you are? Or are you a vegan? Because most of the healthy fats in the omega-3 family are not available in plant-based foods. You can get flax and chia. You can get some precursors to EPA and DHA, which are omega-3 fats, but not robustly so. So animal tissue becomes important, in my opinion, to have a balanced framework around your omega-3. So I would ask you why you were following a restrictive diet. Some people do it for cultural reasons or religious reasons, and I can respect that. But so if you're doing that and you want to continue to do that, and what you're voluntarily doing is you're negating certain foods that are going to give you better quantities of the fats, and so you need to consider supplementation of some fats in an effort to get those levels up. Can you elaborate on whether stem cell therapy could be an option rather than hip replacement surgery? It's possible. It depends. Depends on what the problem in the hip is, Diana. If you've got a hip impingement versus, let's say you've got like a labral tear or some type of joint damage or bone spurs in the hip. I mean, I've had cases where surgery was a better option for people. And where stem cell options failed. I've also had cases where stem cells were able to help a person not need the surgery. So I don't know that one's necessarily better than the other. I think there are frameworks around the individual for what you should be considering. I would say if you're looking to not do surgery or try to prevent surgery as much as possible, I would say go through the gambit of conservative care first. Conservative care would be physical therapy, chiropractic therapy, stem cell therapy, acupuncture therapies, potentially laser therapies, cold and heat therapies, ultrasonic therapies, nutritional therapies. Like, these are all things that for many people can prevent the need for ever having to go to surgery. So do those first. If you've already done those and they've all failed you, now you have to weigh the risk and the benefit of whether or not surgery is going to improve your quality of life. And that's an individual answer for everyone. How do I improve my osteoporosis? Catherine's asking. Catherine, check out our crash course on osteoporosis and bone loss. Pretty extensive information. It's over an hour long. But I can tell you, if you want to start improving it right now, before even watching the crash course, we'll put a link up to that crash course for you. Read my book and follow the diet protocol. No grain, no pain. Because the dietary protocol in that is extremely helpful for reducing the potential for inflammation, autoimmune inflammation around your bone and around your absorption of nutrients that are necessary to help your bones be healthy. Let's see. How to fix or at least improve stuttering blocks. I have been misdiagnosed with celiac disease for almost 15 years, and I have been gluten-free for almost 7 years, but stuttering is still there. Well, one, I don't know if you've been misdiagnosed or not. It's hard for me to even speculate that. If you're gluten-free, are you grain-free? Because most people that go gluten-free do it wrong, and they don't even understand that corn and rice both have forms of gluten in them that can also cause inflammatory damage. They don't understand that oats can cause inflammatory damage in people with gluten sensitivity. So they're not really gluten-free. They're wheat, barley, and rye-free. And so they continue to have persistent neurological problems like stuttering, among other things. And so maybe you are gluten sensitive or celiac, and you've just approached the diet in an incomprehensive way. So I would encourage you to, same advice, check out No Grain, No Pain and get educated about what a true gluten-free diet looks like. And if you're already following that, then you need to embark upon looking at, what other food reactions that you might have beyond gluten. You might want to look at vitamin and mineral status, your nutrient levels, and among other things, but those are great places to start. Been grain-free for 12 years. I can get raw A2A2 milk from a grass-fed, pasture-raised farm. How does a person know if dairy is mimicking gluten? Test. And that's one of the best ways to know is do food sensitivity testing, Lori. But if you've been grain-free for 12 years and you're trying to introduce dairy, I certainly would consider testing as a means to give you kind of a safety net to make sure you're not doing the wrong thing. But A2 raw dairy is definitely the right kind of dairy to introduce if you're going to. How to reset hypothyroidism, dry skin, hair loss. I have anti-smooth muscle antibody and anti-mitochondrial antibody too. So you've got autoimmunity. How do you reset autoimmunity? You figure out what are the triggers. What are the triggers? Food, chemical exposures, nutritional deficiencies, and microbial imbalances. Those 4 categories need to be measured, preferably by a good functional doctor that can guide you through what to do with test results like that so that you can embark on a meaningful diet and lifestyle change that leads to resolution of an immune system that's misrepresenting what it should be doing. Took a dose of 25 milligrams of Benadryl for acute pink eye inflammation. Secondary effect was a reduction in systemic inflammation. Yeah, it's an antihistamine. Histamines cause inflammation, especially hyper-aggressive histamine production. Why do we make histamines? Lots of reasons. We could have allergies, foods that we're eating that we're allergic to. Now, most people think of food allergy and they think of the classic food allergy where your lips swell and you break out in the hives and your throat closes down and you need to go to the hospital to get an EpiPen. I'm not talking about acute allergies. There's something called the subacute allergy, which is you eat a food, you don't have the life-threatening anaphylaxis, but you have a histamine triggering that can lead to systemic chronic inflammation. So getting tested for foods and environmental triggers from that perspective can be helpful. The type of blood testing that can be asked for is IgE, as in IgE, immunoglobulin E testing, because IgE stimulates histamine response. And so what you're experiencing with Benadryl is an antihistamine effect. Now, you could also be low in your gut. You make an enzyme that degrades histamine. This enzyme is very important. It's called DAO, diamine oxidase. This enzyme can be measured. So you can ask your doctor to measure whether or not you're making adequate quantities of DAO, because that may also be a reason why your histamine levels are high and you're benefiting from an antihistamine. You can also check an enzyme in your blood called tryptase. It also can be helpful in that regard. Now, you could also be vitamin B6 and vitamin C deficient. And when you're vitamin C and B6 deficient, you don't degrade histamine as well. And so that's another reason vitamin deficiencies could be triggering this. So there's a lot of different potential things. You should check out our master class on histamine. It's a full breakdown of that whole topic. And I think it would be very helpful for you to understand why Benadryl was benefiting you. So we'll put a link up to that histamine class for you. How bad is rice? I mean, if you're gluten sensitive, don't eat it. If you're not gluten sensitive, understand that predominantly most rice contains high levels of lead, arsenic, or cadmium. And so in that regard, not so good either. I'm not a fan of rice. It's a staple food for anyone, but if you're gluten sensitive, especially, not a fan of it. Can copper build up to toxic levels? Yes, it can. What is the ratio between zinc and copper? It's a trick question. I mean, zinc copper ratio is no such thing as, we could say that there's medical literature that supports that the ratio between zinc and copper in your diet should be somewhere between 10 and 1, 10 zinc to 1 copper. Some studies show 7.5 to 1 ratios are more accurate, but I firmly believe that it's not about ratios. I've seen too many people, and I've done tens of thousands of tests on people's nutritional status over the past few decades, and I don't find ratios, all that valuable in a clinical real-world outcome setting. I find that most people academically want to talk about ratios to sound smart, but in reality, they don't really have a tremendous place. But okay, let me backtrack just a little bit on that. Where you can get in trouble is if you're taking high doses of zinc repetitively for long periods of time, because there's some competition between zinc and copper, and vice versa. But as a general rule, if you're supplementing with multivitamins, if you're taking reasonable amounts of these nutrients, there's not really a zinc copper ratio you need to be worried or scared about. Thoughts on MRT and LEAP? Don't recommend them. What can you advise about vitiligo? Following your book. So if you're following No Grain, No Pain and you have vitiligo, that's a great start. But you really want to understand some other things, Abdul. Number one, vitiligo is not an immune condition of the skin. So what triggers vitiligo? What stimulates the autoimmune response to the skin to depigment it? Food. So No Grain, No Pain is a good place to start, but you should seek testing. Seek testing for food sensitivities. Number two, chemical exposures. You should seek testing to see and to help to determine whether or not you're reacting to certain chemicals. And this is especially true in vitiligo of chemicals you might apply to your skin, things like soaps, shampoos, detergents, lotions, etc. Number three, I see very commonly with vitiligo, I see people with yeast overgrowth. So your microbes, have your microbiome measured and assessed by a good doctor. Number four, make sure you're measuring your nutrition status, not just vitamin D. You mentioned there vitamin D, but folate and vitamin B12 play a role in vitiligo, as do other B vitamins. Copper can play a role in the development of vitiligo. So you want to have all of your essential nutrients measured and checked, because it could be any one of those things or any combination of those things that could be contributing to your problem. Let's see. Any suggestions for severe back muscle pain? Why is it happening? There's a lot of reasons severe back muscle pain can occur. I mean, did you injure it? Do you have a chronic urinary tract infection that's referring pain to your back? Do you have undiagnosed kidney stones that are referring pain to your back? Do you have muscular weakness? Do you sit too long? Do you have a sedentary type of job where it puts pressure on your back in an abnormal way that leads to atrophy? Do you have disc herniation? Do you have nerve impingement? Do you have something like a sciatica? There's just a lot of things. Where you can start if it's pain is it's inflammatory. So great place to start is No Grain, No Pain. Change your diet. It's amazing to me, in my practice history, especially early on, because I ran a rehab clinic for a number of years, and so all we dealt with was chronic degenerative back pain and severe back pain injuries. And it was amazing to me how many people were non-responsive to therapies, but when we changed their diet, it was like a light switch. So I would start with diet change. You can also look up a good chiropractor, look up a good physical therapist. You could consider magnesium and calcium, because if you have deficiencies there, it can cause muscle cramping in your back muscles, and that can lead to compression of the disc spaces, among other things. So, I mean, there's just a lot to unpack with that type of pain. You might also, Terry, check out our course on home remedies for pain. I go into depth on a lot of different home remedies that you might also apply or try. But home remedies are great, but you really want to understand why the pain is there. I'm a fan of getting you relief, but I'm a bigger fan of understanding why it's happening, because if you know the why and you're empowered to make the meaningful changes that matter the most, then you don't need home remedies. You can just be pain-free. Do you ever encounter heavy metal overload as a consequence of creatine synthesis mutation, and how long on average does it take to detoxify heavy metals using zinc and protein? You're not going to detoxify heavy metals using zinc and protein, depending on the kind of heavy metals you're referring to. But to properly chelate somebody from a heavy metal overload, it can take anywhere from 3 months to 18 months. How can we get heavy metals out of the body? Chelating agents, I mean, you understand that your body is going to work to remove heavy metals all the time. That's part of the job of your liver and your bowels and your kidney and your lungs. They're constantly removing environmental poisons and toxins, including heavy metals. But there are certain key nutrients that play a major role in heavy metal detoxification, and many of those are minerals and nutrients that support liver function and liver biotransformation. So what are some of those? Vitamin C is probably one of the main ones. You also want to look at cysteine and sulfur-containing amino acids. You want to look at glutathione. You want to look at selenium and vitamin B2. You want to look at B vitamins, especially the ones involved in the methylation process, like B12 and folate and B6, as playing a role. Because if you're solid nutritionally in that front, your body's going to be a better detoxification machine, no matter what the situation. But if your problem's bad enough and you have heavy metals bad enough, then chelation is a next level process that you really want to look at doing. Do I recommend a low thiol diet for mercury toxicity? No, not generally, Monica. My experience in people that react in those situations is that a lot of times they have molybdenum deficiency, and so they can't process sulfur very well, and so the low thiol diet is basically a restriction in sulfur. If you add molybdenum, you might find that you can tolerate thiols just fine, and also might find that you can tolerate things like glutathione and cysteine better. How concerned should I be with an LDL at 236? I fractured my ankle, resulting in 6 surgeries, including a total ankle replacement. I mean, there's not enough context, Bonnie, to answer your question. I mean, would I be concerned with an LDL at 236? It depends on the context. Did they do an LDL fractionated test where they broke down your LDLs to see if you had oxidized LDLs elevated, or whether you had, what particle sizes of LDLs are we talking about? Because there's context there. There's also context around whether or not you have inflammation, because as a general rule of thumb, LDL is not dangerous unless you're inflamed. If you're inflamed, then LDL can become atherogenic and create increased risk for plaquing. But if you're not inflamed, if your diet's dialed in, your lifestyle's dialed in, your blood vessels are relatively okay and not inflamed, then the LDL being elevated like that's not a non-entity. The other thing is LDL can go up. This study just came out. I've been meaning to do a video on it. I just haven't yet. But LDL goes up acutely when you're under stress. So let's say you're stressed out. Part of the reason you're stressed out is because maybe you're sick or maybe you have a problem. You go to your doctor, you're at a doctor's office, and most people aren't happy to be at a doctor's office. It's stressful to be at a doctor's office, and you get your cholesterol levels checked. Well, acute stress causes cholesterol to go up, and this research that shows as many as 15-point elevations under acute stress. They've actually even shown that going from a seated to a standing position and having your LDL cholesterol measured will lead to elevations. You'll get pseudo or false elevations in your LDL cholesterol. Now, I know many of you have never been told this by your doctor, but lots of things can raise your LDL. You could be trying to make new brain synapses. You could be trying to make sex steroids like estrogen or progesterone or testosterone, because LDL is a precursor to these things. You could be fighting an infection, and it doesn't have to be an acute infection. It could be a systemic chronic infection, and so LDLs will go up when you have a greater need. We'll see a lot of people have higher LDLs when they're involved or surrounded by mold. Mold can cause an elevation of LDL. So I don't like the concept of treating LDL with statins. I think that's a flawed concept, in my opinion. I think we've been seeing doctors do that since the 80s, and the outcomes suck. We don't have less heart disease and less stroke. We don't have less complications. We have more complications in heart disease and stroke, and we have more heart disease, despite statins being the top prescribed drugs in the world. So if statins worked at being effective, then we wouldn't see as much. And so because we don't empirically, we can say that the research is probably biased and probably influenced as a result of profit motives. Love your thought on thermography. I had asked you about my belly button seeping. Conventional found nothing. There's a small lump beside my belly button. 30-year-old laparoscopy scar. Conventional doc did basic blood tests. They refused my request for an ultrasound. They said my blood test came back normal range, but didn't go over them. Thermography may reveal something. Maybe. I mean, thermography is just going to measure heat distribution in the tissue. So you could, let's just say it does reveal something, that you have a hot spot on that bump. It only tells you that you have a hot spot. It doesn't tell you why. So thermography can be helpful in kind of, if you have a positive thermography, think of it as it should trigger the next step of testing. If you have thermography that's positive, thermography itself is relatively non-diagnostic. It's not. It can tell you that the tissue is hotter, but it can't tell you why. I tried everything to get rid of my yeast overgrowth for months. I still have issues. What's the next step to take? Give me better context than that. You say you tried everything. That I can hardly believe you've tried everything. So context around what that means. Number two, how do you know you have a yeast overgrowth? Was it a culture? Were you diagnosed properly? Are you assuming you have a yeast overgrowth? Because you may be taking a bunch of antifungals, but you may actually have a bacterial problem, or you may actually have a food problem that looks like a yeast overgrowth but isn't. So, there's a lot to be said for those assumptions. Robert, you got to give me more context. That if you have alkalosis, your pH is 8.5. Is that your saliva pH? Is that your urine pH? Is that your blood pH? I can't imagine it being your blood pH. You'd be in a hell of a problem if it was your blood. But better context helps me help you. I have B6 toxicity from energy drinks. Is there a way to get rid of this? Time. B6 is water soluble, so it's gonna penetrate out of you. It has a short half-life. So time. Stay away from pyridoxine hydrochloride as a supplement in any products or vitamins that you're using for the time being, so that you don't add more B6 to that equation. Is rosacea on the face with redness and pimply bumps caused by a bacteria? It can be. Some people find, Debbie, application of ionized silver to be very helpful in that regard. Or I've seen cases where, even, dermatologists prescribe antibiotics for rosacea and it clears up. So it absolutely could be bacteria. You could get a culture if you follow up with a doc and ask for a culture. That would give you a better answer. Can fibromyalgia be reversed? Yes. Check out our video on fibromyalgia. If you've been diagnosed with fibromyalgia, the likelihood you're in mold is pretty high. So also maybe check out our multi-part series on mold toxicity. I'm deficient in tryptophan. How can that affect the gut? Tryptophan is a direct precursor to serotonin, which is one of the primary neurochemicals that regulates gut peristalsis. So it helps your gut motility. So that's one of the big ways it can affect your gut, Eric. How to test and remove biofilms. There's not a ton of great testing for biofilm. There's one lab. There's one really good lab, Microbiology DX, that can do culture tests for biofilm itself, but I'm not aware of any other labs that do, really advanced biofilm testing. As far as how to remove a biofilm, some of the best natural ways to help reduce biofilm is proteolytic enzymes. Proteolytic enzymes are, enzymes that break down proteins. We have a formula called matrozyme that I like to use in this regard when we find somebody that has biofilm. How important is it to remove fungus and the overgrowth? I'm not sure I understand your question because it's worded strange. How important is it to remove fungus and the overgrowth due to sepsis? Antibiotics caused it. You mean you took antibiotics because you had sepsis, and that led to a yeast overgrowth or a fungus overgrowth? It's important to control any fungus overgrowth. Fungi produce toxins, mold toxins. They also act as fermentation agents. So they will ferment your carbohydrates in your diet and convert your carbs into alcohol. So then you can actually develop something called autobrewery syndrome, which is where your body becomes a wine factory because of fungal overgrowth. So it's pretty important to get those under control. I live in New York City. Any way to order tests from you? Yeah, you can get a P.O. box across the state line. New York City is, unfortunately, it's a tyrant. The state is a tyrant as it relates to medical freedoms for their citizens. It's just awful what happens there and the restrictions that people are put under for their own health. But we have a lot of people, Eileen, that cross the state lines to get testing done. And in that regard, it's simple to do. My 6-year-old son has I assume you mean juvenile diabetes mellitus, JDM. His muscles have shortened and has contractions in the knees and elbows. Will control of inflammation help his muscles recover? What's best for contractions? Lots of things. So 6-year-old with JDM, one of the problems that you're gonna struggle with is glucose regulation in the blood, because sorry, I'm just thinking through that. Maybe give me clarity. Does he have juvenile diabetes, or does he have? Are you saying juvenile dermatomyositis? I don't want to go through the whole spiel unless I'm accurate in what condition you actually mean, and there's too many medical acronyms for me to try to guess at that. I've been told by a doctor that B6 supplements cause neuropathy. Is that so? Not really. It can. It's pretty rare. You have to be on high doses for a pretty long time for B6 to contribute to neuropathy. But typically, it's high doses of PHCl, pyridoxine hydrochloride, not P5P, pyridoxal 5-phosphate, metabolized very simply by the body and doesn't generally tend to contribute to neuropathy. But pyridoxine hydrochloride can. What would you do with a child that has strep throat for 8 days? I don't know. It depends on a number of factors. Is the child running a fever? Is the child improving? Is the child not improving? I mean, I always like to say with general infections, give the body's immune system a chance first. I mean, before you pump them full of drugs. That being said, what are some things that could be helpful? Gargling with silver, like an ionized silver or hydrolyzed silver. Could potentially be very helpful. Taking vitamin C, taking vitamin D, especially if that child is not getting adequate sunshine. N-acetylcysteine can be extremely helpful. I mean, there's a lot of nutritional support that you could throw at a child with strep throat, but a lot of it just depends on the context, because if he's running 105 fevers and lying in bed and, lethargic and can't think and can't really talk, and you might need to get something a little bit more aggressively done. Just depends. Is it a good idea to remove gluten during perimenopause to help with hormone shifts? It's a good idea to know if removing gluten is the right move. There are situations where gluten can cause endocrine disruption that leads to what we would call pseudomenopause, meaning it makes a person believe they're in menopause when in fact they're being gluten disrupted. I've seen so many times where women go gluten-free and their cycles return. They thought they were in menopause for the last 2 years, and now they're gluten-free, and their hormone cycle comes back. And they weren't in menopause. They were actually being damaged by gluten. Their endocrine system was being disrupted. So it's a great idea to go gluten-free if you're in perimenopause, and it's not really menopause, it's pseudomenopause, and the cause of that is gluten. I don't know if I answered your question, but that's the best I can do. Was just told that I have cervical spondylosis based on an MRI. Any tips for this? Conservative care, conservative management. Cervical spondylosis generally responds really, really well to chiropractic care and to physical therapy and rehab. So all of those things would be good places to start. Question on that is the spondylosis, well, never mind. Start with those options first. Why is my white blood count a little high? There's several reasons why white counts might be high. Infection is one of the more common ones. Chronic immune exposures. So infection could be viral, bacterial, fungal. Environmental exposures to poisons could elevate your white counts as well. So I mean that could be anything from like mold to radon, or gas. So I would look at those different things. Now you might ask your doctor too for what's called a differential, where they look at not just your white counts, but they break down your white counts. Which white cell is elevated, or is there one in particular? Like, are your neutrophils versus your monocytes, basophils, eosinophils, or lymphocytes elevated? Because the different white blood cells have different functions. And so if your neutrophils are elevated, it's very commonly that's a bacterial infection. But if your lymphocytes are elevated, that's very commonly can be a chronic viral infection. So it just depends. But lots to unpack there. What happens when dairy is mimicking gluten? Then you still have reactions that are similar to what you would have if you were eating gluten. Check out our crash course on dairy. There's been several questions about dairy today, and we have a pretty nice crash course on the ins and outs of dairy and the nuance of that. What do you think of the actual results from doctor's perspective of chiropractic care? I've heard a lot of doctors don't like to refer to chiropractors. Now, I would say that's probably true, Julie. Chiropractors are great doctors. What other doctors think about them, I can't control. But as a general rule of thumb, if you look at chiropractic schooling versus medical schooling, pound for pound, chiropractors have more hours in physiology, more hours in anatomy, more hours in pathophysiology, more hours in nutrition, more hours in biochemistry. So the educational platform of chiropractic school is, definitely not secondary to medical school. A lot of people don't understand that. But there was a really good book you might consider reading if you're interested in this topic. It's called Wilk versus the AMA. Wilk was a chiropractor who sued the American Medical Association because he was tired of being blackballed by the medical community. Because chiropractic is kind of like the proverbial redheaded stepchild of medicine. The doctors that are smart, but everybody tries to talk bad about and try to criminalize or devalue for no other reason than that chiropractic is a direct threat to the medical monopoly that currently exists. So many chiropractors are so well versed in diet, lifestyle, nutrition, and physiology of the body that when a patient goes and sees a chiropractor and gets care, their need for medicine goes away, and medical doctors don't like that because it takes them out of their monopolistic position. And so there's, anyway, back to Wilk versus the AMA. Wilk sued the American Medical Association, proved that they had purposefully created a marketing department within their organization that sole purpose was to fraudulently accuse chiropractic and other alternative forms of medicine as being non-scientific. And so they created all this false propaganda about chiropractic care. And it wasn't just chiropractic, it was also acupuncture, and it was massage and other forms of alternative treatments. And he proved it, and he won the case. It was an anti-monopoly case, and it was settled for an undisclosed amount of money, but proving that, again, most of the propaganda any of you have ever heard about chiropractors not being real doctors is really not true at all. It was propaganda created by the medical boards, or specifically the AMA. So I don't know if that's helpful, but a lot of doctors, won't refer to chiropractic, not because it doesn't work or it's not beneficial or helpful, but because just like many people, medical doctors oftentimes are ignorant as to the value and the benefit of that type of care. The way I see chiropractors is they're the original gangsters, they're original functional medicine doctors, because the core philosophical principles of chiropractic care is, that the body has an innate intelligence within it to heal and repair itself if you get out of the way. And so if you quit choosing behaviors, bad food, bad lifestyle, then you remove a lot of the things that interfere with healing, and the body can heal itself and doesn't require medicine. Been taking around 6 grams per day of vitamin C, non-GMO recently, and noticing heat release all around my body, similar to the fever. It's not uncomfortable, just curious, is this a histamine response? Probably not a histamine response, although it could be depending on the vitamin C that you're taking. I've seen some people react and have allergies to the vitamin C, even though it's non-GMO, it's probably derived from corn. And so corn can create those types of reactions for many people. So that's a possibility. I would say find you a non-corn derived vitamin C and do the same experiment, and it might give you a better answer. I'm constantly feeling low, anxious before, especially during my period. What would you recommend? You're probably anemic. You're probably going into anemia, Salita, as you come into your cycle. When women lose blood, they lose iron. And when you lose iron, you become anemic, and that anemia can cause you to feel low and anxious. And that you lose the blood before your period starts. The blood actually pulls into the uterus lining, so it comes out of your circulation. So you might have your doctor measure your iron and ferritin levels and see what do those look like. If they're low, consider eating more iron-containing foods and possibly supplementing with iron and see if those symptoms improve. Why the emphasis on doing nothing in the medical community and leaving people miserable for decades because of complete reliance on numbers? It's called treating the lab. When you treat the lab and not the patient, unfortunately, you create a miserable patient. And it's not done for any other reason than out of ignorance and out of, a lot of doctors are just ignorant. They don't, and I don't say this is a demeaning thing. A lot of doctors are just ignorant as to why their patients are sick, and the labs look normal and they don't know what else to do. So they're not really trying to leave you miserable. They don't know what else to do. They're at an end of their knowledge base, which is a sad shame. Now, beyond that, they're also working against an insurance system that if they try to go do a bunch of advanced diagnostic workup on a patient, they get penalized by the insurance company for being more expensive and spending more money. And so a lot of doctors won't do that, especially the doctors that work under the corporatized healthcare systems, because you have to remember a lot of practices and hospitals have bought up, and now they own the practices in the hospitals. And so now the doctors are under these standard of care directives to not do additional workups because these companies are trying to make a profit and they don't want the doctor ordering tests that cost more money. I know that's a sad state, but that's just the reality. Best water system to install. The best water system it depends on where you live and where your water comes from. If you live in the city, the best water system to install is a whole house carbon KDF filter combined with an undermount sink reverse osmosis filter. If you have a well, the best system to install is a good carbon KDF filter on your well. You don't need the reverse osmosis if you're on well water. The reason why we like RO is because it removes a lot of the medicines that are found in city water. It removes fluoride. Carbon doesn't remove fluoride very well. So the RO, we want that fluoride out of the water. I know the city puts it there on purpose, but it isn't, why they do that, it's beyond me. We know that fluoride's not good for the brain. My mother feels dizzy in her head. Last couple of weeks, she was told to check blood pressure every day. Turns out to be a bit lower. 106/70. That's not low. That's pretty normal. My blood pressure is actually lower than that. and I'm not dizzy, she should go get checked out. I mean, there could be a lot of different things going on. She should have maybe some ultrasound or Doppler of her carotid arteries, make sure she doesn't have any occlusion, blood flow occlusion issues that could be causing that. I mean, there's just a lot of different things that it could be, but I would err on the side of caution and get it checked out. Alkalosis treatment for urine pH at 8.5. So we've got clarity on the urine. You may not need any necessary treatment. Robert, I would start by analyzing your diet and seeing what you're eating. And, I see a lot of times that high level of urinary pH like that in people who are trying to avoid all animal meats. Again, I'm not a fan of vegan diets. I think some people can pull off varied vegetarian diets pretty well, but vegan diets, not so much. But consider looking at your animal protein quantity, because that's one way you're going to get your pH up, or I should say your acidity up, your pH down through your urine. Anhidrosis is oftentimes, Julie, a symptom of toxicity, where people aren't sweating properly. So I would consider what you may be being exposed to that's driving toxicity, and consider that. The other thing you might do and look at is infrared as a means to help support sweating, and turning on the sweating mechanism as a detoxification pathway, because sweating is also partly controlled by parasympathetic neurological function, and so you may be sympathetic dominant, and that's partly why you're not sweating. Any truth to metal dental implants being toxic? Yeah, I mean, you could be allergic to your implant, and any of you looking to get metal implants dentically or from a dentist, you should ask for what's called material compatibility testing, where they actually test to see whether or not your immune system would react to the metal that they want to embed into your body. And that's true of any surgery, right? Whether it's a dental implant or a hip replacement, you should always ask for testing to make sure that the metal is compatible with your immune system. Any input on sudden onset OCD? It's probably not sudden onset. It's probably the proverbial straw that broke the camel's back. But OCD, a lot of people with OCD are anemic. So I would start looking at iron and B vitamin deficiencies as kind of an easy, low-hanging place to start. Started with ultra liver detox and doing a binder, but struggling with energy levels. Anything you recommend? Lots of things I would recommend. Figuring out why. It's really hard to just give you a generic, are your energy levels low because you started on those supplements? Or are your energy levels low before? Are you being exposed to the toxins that you're trying to detox currently? Because this is another reason why people going through detox get tired, is they're still retoxing. With the number one rule of detox is don't retox. It's not to expose yourself to the toxin that you're trying to get rid of. And if you are, then any kind of detoxification efforts can be compromised, and symptomatically fatigue can be one of the things that is a side effect. You might also just be going through kind of an initial phase reaction that if it doesn't subside within a week or two, then now you start looking at those other things. Okay, so yeah, it was juvenile dermatitis was the question that was being asked earlier. So I was wrong. I read the acronym wrong. So I mean, juvenile dermatitis, I would start with a child with juvenile dermatitis. It's autoimmune, so I would be measuring food, chemicals, microbes, and also micronutrient levels to make sure they weren't deficient. I mean, you got to start with those four, because those are the four primary driving triggers for autoimmunity. And specifically start with gluten. Question about sourdough. I think we have an article on sourdough. you can check out, Daniel. Sourdough is better than regular bread in terms of quantity of gluten, but it still contains gluten. Sourdough bread is not gluten-free. It's gluten-reduced. And so if you're gluten sensitive, this is why it's important to differentiate. If you are gluten sensitive, you're still going to get gluten exposure eating sourdough bread. Are our products corn-free? Yes. If bun creatinine ratio is high, what does that mean? Not much. I don't really hold a whole lot of stock in bun and creatinine ratios. Really, you look at bun, you look at creatinine individually, and then you look at GFR, glomerular filtration rate. These are all markers for kidney function. The bun creatinine ratio, don't put a whole lot of weight in that, because it's very common to be high, especially if somebody's eating adequate protein. Very long-term low blood iron due to duodenal celiac, now supplementing iron protein succinylate. Is it possible to cure the duodenal celiac? Yes, absolutely. You got to be grain-free, Aaron. Check out Glutenology Masterclass if you haven't. I mean, most celiacs that come into my influence come in misunderstanding what it means to be on a gluten-free diet. And so they're doing their best and they're following, their doctor's guidance, but most doctors don't understand that, and this is true of most GI doctors, don't understand the nuance of celiac disease and all the different variable things that can also be problematic and delay healing. And if you watch it in Glutenology, it's a free class. You can go to glutenology.net/registration. It's about 14 hours long, but follow that class, apply that information, and there's no doubt in my mind you could heal your duodenal celiac. Let's see. Not sure I understand your question, Judy. Answer a question about carbs. What would be the acceptable level? If you're talking about quantitatively how many carbs a person should eat, it's a highly variable answer because it depends on what you're doing. I generally like to start people in their carbohydrate levels, about a third of their dietary calories coming from carbohydrates, approximately. But that will vary based on how much exercise you're getting. It will vary based on other things that could be going on. If you have a yeast overgrowth, as an example, then carbohydrate reduction is sometimes necessary to overcome or conquer yeast. Is synthetic version of C helpful in any way? I can't find the organic version in supplements. Go check out Detox C, Jerry. It's derived from an organic African sweet potato. So not synthetic in what you're thinking. A lot of vitamin C is derived from synthetic chemical processes that are from genetically modified corn, but not ours. Please talk about the difference between gentle chiropractors versus the bone wrenching type. I don't know what you mean. There's a lot of chiropractic methodologies, but I mean, if you're talking about gentle, like somebody who uses an activator technique, which is a kind of a mild pressure manipulative technique, versus say a doctor who uses their hands to perform manipulation. Everyone's different, and everybody's tolerance to the sound of, say, a neck adjustment might be different. I think it's not that a chiropractor is necessarily bone wrenching. It's that every chiropractor has to look at the patient in front of them and has to address them based on their, based on their problem, but also based on their capacity to handle a manipulation. Because, if you take somebody, for example, with torticollis, severe tight neck muscles, you can't just walk up to that person and crank on their neck. You've got to prepare them. You've got to, do things that calm the muscles, calm the spasm, relax the neck, stretching. There are a number of components to proper chiropractic care. So I don't know what your experience has been, but if you've been to somebody who was too rough or aggressive, find somebody different. Don't judge your experience of the chiropractic care based on, one bad experience, no more than you would judge the entire medical community based on one bad medical experience, or you would judge, your experience of plumbers on one bad experience. Like, I like the plumber analogy, because if you had a bad plumber, and they did a bad job, it doesn't mean you never call a plumber again. It just means you call a different one. And it's not different with any kind of profession. So if you're the type of person that doesn't like, or is uncomfortable with more of an aggressive hand manipulation, then let your doctor know so that they can accommodate that fear for you. Let's see here. Scroll down on the left for me. Oh, sorry. Yeah, there we go. Recent blood test shows I'm low on vitamin D. What's your recommendation on an amount to take daily and how long? Yeah, I'm not going to give you a specific recommendation, Kathy, but I would just generally say it's very safe to take, 6 to 10,000 units a day for a few months, and ask your doctor to recheck it after that time frame, unless you have active ongoing kidney disease or a condition called sarcoidosis, which then you would want to talk with your doctor more specifically about how to supplement. What could the problem be if you have pain in your breasts? You could have an iodine deficiency. You could have a progesterone deficiency. You could have an estrogen dominance. You could have a problem with being exposed to chemicals that contain estrogen mimickers. Chemicals could be plastics, cosmetics, certain species of mold make estrogen mimicking mycotoxins. So, I mean, there's just a lot of things there. But nutritionally, vitamin E, iodine are pretty common for breast tenderness. Can I do anything nutritionally to slow down or reverse cataracts or astigmatism? Yes, Petra. Check out we did a whole show on the vision on eyes. I'd encourage you to go watch that show. Best way to get rid of chronic inflammation is to figure out what's causing it. That's it. That's the answer. You have to know why it's there. If you don't know why, you can take all the supplements in the world, take all the medicines in the world to block your ability to have inflammation, but you're not going to really have any meaningful outcome until you figure out what's driving the inflammation. Food, chemicals, micronutrient deficiencies, and microbial imbalances are the four most common families of triggers. Let's see, Julie. I took the nutrition deficiency test. I'm insufficient in biotin and low in B9. You could take a B complex. It's rich in both of those, Julie. You could also take them individually. 8,000 micrograms of biotin is a good place to start. 1,000 micrograms of B9 is a good place to start. As far as isoleucine, absolutely. Isoleucine deficiency is very important, or isoleucine is a branched chain amino acid. It's very important in maintaining your muscle mass in your physical frame. So this is especially true if you're working out and you're finding you're getting very sore, or you have a lot of recurring muscle aches and pains. That isoleucine is going to be very important for you. Any good ideas to eat snacks? I have a sweet tooth. I mean, there's all kinds of snacks. Go to glutenfreesociety.org and check out our recipe section. We've got over 300 recipes there that might be helpful for you. But if you have a sweet tooth, you might consider that you might be chromium deficient, vanadium deficient, B vitamin deficient, magnesium deficient, or glycine deficient. Deficiencies of those nutrients can cause sugar cravings. And so I find that when people have a sweet tooth, sometimes correcting those deficits, the sweet tooth goes away. Is it possible to wean off of blood thinners? Yeah, with guidance for sure. Definitely possible. But the other question is it probable that your doctor will help you? Most doctors are pretty adamant about blood thinners once they put a person on them, but the research doesn't really support that. Post-stroke or heart attack, blood thinners, if there's been a stent placement, a lot of doctors will use blood thinners as kind of a minimum for the next 6 months. Afterwards, then that's where you'd want to have that conversation and just get them on board with what your goals are, but it's definitely possible. Question about ApoB, how to lower ApoB. Change your diet, change your inflammatory parameters. ApoB usually follows suit and comes down. Start with no grain, no pain, as far as a diet recommendation, and then get tested. If it's not coming down, get tested for other food reactivities or food sensitivities. How to prep for a filling replacement. My body doesn't handle Novocaine, months of fallout. Take vitamin B12 at high doses before you go in to get the work done. 10,000 micrograms for a week before, and stay on it after the fact, and you might tolerate it better. But also talk to your dentist about other options, about other pain relief options. Thoughts on AS and how to manage it holistically? Yeah, best way to manage it on the surface is no grain, no pain. If you're referring to ankylosing spondylitis. Thoughts on sprouted bread, such as Ezekiel? It's got gluten in it. If you're gluten sensitive, it's no good. Don't do it. Okay. 15-year-old almost always has cold hands, feet, and palms are burning. B vitamin deficiency. Check her thyroid. She could have low thyroid. She's probably gluten sensitive. If her thyroid's low, it's probably being caused by gluten. That's where I would start. Look in those directions. Should I be able to go to my doctor for whatever reason ails me and ask for testing that I think may pertain to the ailment, i.e. lethargy that isn't normal? So can you please check for a specific deficiency that I dictate, or does he have to agree to it and find it plausible? It depends on your doctor, Stacy. I wish we could say, yeah, they would talk with you as an intelligent adult caring about your own health and take your concerns into consideration and help you. But so many doctors are not trained in nutrition, and so they won't measure it, not because it isn't a thing to measure, but they'll measure it. They won't measure it because they'll dismiss it because they're not trained in it, and their egos can't handle the fact that if they tell you they don't understand it, they'll look stupid. And so instead, they try to make you feel bad and say, I'm not going to order it because it's not pertinent or necessary. It's called gaslighting, and it happens every day in a medical setting. So, you got to find a doctor who's intelligent, who's caring and empathetic, and who will have a conversation with you. And I always say, your doctor, you shouldn't have a dictatorial relationship with your doctor. You should have a mutual communication relationship with your doctor, just like you would with any other professional. You rely heavily on their advice, but they should rely heavily on the feedback that you're giving them, and they shouldn't dismiss that feedback or that context that you provide, because the context is arguably one of the most important things that a doctor could listen to in order to help you. Let's see. Belinda says, doctor suspects that I have plaque buildup. He's not overly concerned about it yet, as other tests don't show any issue with heart muscle or valves or blood pressure. Is there a natural way to reduce or remove plaque? Yeah, lots of things to do, but probably if you've got plaque buildup, depending on the extent of it, you probably have inflammation, because that's what's a precursor to plaque building up. So, did he run tests that measure vascular inflammation, CRP, MMP9, erythrocyte sedimentation rate, D-dimer. These are all markers that could indicate inflammation in your blood that could drive the production of plaque formation. So those things should be taken into consideration. Food triggers can drive plaque formation. Heavy metals like lead can drive plaque formation. Things that support vascular health, vitamin C, probably one of the best things, niacin, which is vitamin B3. And then you have the gambit of other nutrients like B12 and folate. I mean, they all play a role in supporting your body's ability to regulate inflammation in the vascular tree, so which again reduces the potential for plaque buildup. So that can all be measured, and it should be. Your thoughts on the idea that 25% of the population doesn't clear mold toxins? No, I think 100% of the population clears mold toxins. I think how a person clears mold toxins is dependent upon a vast array of other variable factors and how they live their life. And so, when you're looking at the genetic markers for mold as an example, I mean, they're good markers to understand, but they're by no means are they the sole reason as to whether or not a person can or cannot detox. There are other markers and there are other variables. The number one variable in how you clear mycotoxins, as an example, is getting out of the exposure. That by default, the very nature of a mycotoxin test, if you're trying to assess somebody for mold detoxification, the fact that you can measure them coming out in the urine is an indicator that the person is in the process of detoxing. And so it's not an issue of whether they can or can't, it's whether or not they're being overwhelmed. And when the system's overwhelmed, they can't detox faster than what it's coming in. Stacy, if you're asking about ingredients for skin, makeup, and lotions and shampoo, great place to start is the environmentalworkinggroup.org. They have great lists of a lot of these products and the toxic compounds that are in them. So it's a great place to start in terms of making yourself familiar with which kinds of ingredients you're going to want to avoid. What's good for meniscus tear? Rehab. Rehab for sure. I mean, get with a very knowledgeable chiropractor or very knowledgeable physical therapist. Get an assessment, preferentially if you've already got a diagnosis. Get a physical assessment, and then somebody can custom formulate a rehabilitative protocol to help you overcome that injury. I don't know that I understand that question. Maybe yoga would help with stress and bloating. I have a sweet tooth. How can I test this? Test a sweet tooth? You know, there's not a test for sweet tooth, and I'm not sure I understand what you mean. But can yoga help with stress? Yeah, sure. Stretching is great for stress mechanism and stress response. If you're bloated and you have a sweet tooth, there's likelihood you have a bacterial or a yeast overgrowth in your intestines is pretty high. So I would say get a good microbiome test from a good doctor who understands them and understands which kinds of tests are the best to measure, and get it assessed, Holly. Okay. Well, I think we've covered everything we can cover at any rate. We're over an hour in. Thanks for tuning in. If you're new to the show, if this is your first time, welcome. Hopefully you'll be back here next Thursday for another live Q&A at 12:30. We're here every week, minus holidays. And don't forget to join us every Tuesday at 6 p.m. for crash courses on a variety and array of health topics. And if you want more information about how to improve your health naturally, come visit me at glutenfreesociety.org. Sign up there for our newsletter, and I'll send you a bunch of free information about how to overcome autoimmune inflammation naturally with diet and lifestyle changes. Thanks so much for tuning in. We'll see you next week. Have a fantastic